Difficulty breathing.
BSI, is my scene safe?
Your scene is safe.
Mechanism of injury or nature of illness is difficulty breathing. And is this my only patient?
This is your only patient.
Going to call for additional resources, so I need an ALS ambulance.
They're on their way.
Going to consider C-spine, but we're not going to follow through with it at this moment. We'll reconsider later.
Okay.
My general impression of the patient, all I know is that he has difficulty breathing, so what's my general impression?
You walk in on your patient. He is tripoding. He's breathing rapid and shallow. He's speaking in 1 to 2 word sentences, and he's pale and diaphoretic.
Okay, my general impression of my patient is that he's tripoding, so he's bent over. His breathing is rapid and shallow. He can only speak in 1 to 2 word sentences at a time. He's pale and diaphoretic. So to check the responsiveness of my patient, I'm going to ask him some questions, check his A&O status. So to my patient, what's your name?
John.
And do you know where you are?
We are in our trailer.
And do you know what's happening?
Talking to acute EMT.
Do you know what time it is?
It's around 5 o'clock.
Okay, so I label my patient as alert, but still can't talk through full sentences because of his difficulty breathing.
Good.
So chief complaint is difficulty breathing. Do I have any other chief complaints or apparent life threats?
Just the difficulty breathing.
So next, I'm going to assess my patient's airway and breathing. Airway seems to be clear, because he can speak clearly.
It's clear.
Breathing is clearly labored. Equal chest rise and fall, but breathing is still shallow and rapid. I'm going to listen to lung sounds when I check respirations. I'm ensuring adequate ventilation. I'm going to initiate appropriate oxygen therapy. So I'm going to start my patient now at 10 liters, non-rebreather mask, and then reassess down the line, change it as needed. I'm going to check my patient's circulation. So with that, I'm going to check the skin's color, temperature, and condition. I'm going to check my patient's pulse, and I'm going to assess and control any major bleeding. So I already know my patient is diaphoretic and pale. So as I'm checking my patient's pulse, I'm also going to note if my patient is, what the condition of my patient's skin is. So my patient feels cool. Do you agree?
Your patient is cool.
Okay, so I'm going to check my patient's pulse. My patient has a pulse of 74. Do you agree?
Your patient's pulse is 108.
Okay. D, I'm going to determine the priority level of this patient. I'm going to give him a high priority level because of his difficulty breathing. We're going to transport him to the hospital.
Sounds like a good plan. Good job.